Today's Doctor is in. A different way to fight back against cancer. The American Cancer Society is looking for 300,000 participants from across the country for a new cancer prevention study. And Dr. Scott Ackerman, one of the First Coast's leading oncologists, is here to tell us what past cancer prevention studies have revealed and what they're hoping to accomplish with this one in the future. Thanks so much for being here, Dr. Ackerman.
Thank you, Casey. It's good to see you.
So tell us, what are the American Cancer Society prevention studies all about?
Okay, so the American Cancer Society has, for the past 60 years, led these large-scale prospective studies of behavioral factors, environmental factors, and try to find an association of these factors with cancer development. So back in the 50s, these thinkers started figuring out what to do, and the first cancer prevention study, what we call CPS-1, Cancer Prevention Study 1, began in 1959, and they enrolled 1 million people, 1 million men and women, and they watched them and they monitored them for 13 years, from 1959 to 1972. And they were specifically looking at diseases that might be associated with tobacco use, and they found in that study that cigarette smokers had a 10-fold higher risk of lung cancer. Now we know that is,
common
commonplace
knowledge,
today.
but back in the day.
Right, there was a lot of controversy about whether cigarette smoke was associated with lung cancer. So that was a landmark study that found the association between cigarette smoking and lung cancer. Then about a decade later, 1982, began the second cancer prevention study, CPS-2. Right. Again, 1 million people, and they're still collecting data from these people. So it's been 30 years since then, right? Yeah, 30 years. And they're still collecting data, but they've already made a number of connections. A few interesting connections. One is that they have found that those people that take aspirin have a lower risk of colon cancer, so that you take aspirin on a regular basis, so there may be a protective effect of aspirin on colon cancer. We also saw this in a study from England where they looked at people that they gave aspirin to had lower risk of colon cancer and breast cancer, so those data is consistent with the British data. Also, they found that people who had exposure to pesticides had a higher incidence of multiple myeloma. So there's other things too, but those are two big things that came out of this study. And again, those patients or those people are still being followed and data is still being collected.
30 years. Wow, to be enrolled. So now what's on store next? So we're up to CPS-3.
Correct.
Okay.
So CPS-3 is a smaller study. 300,000 Americans across the country, including some here from the First Coast. And the goal of this is to look to better understand genetic factors, behavioral factors, environmental factors, and lifestyle factors that could cause or could prevent cancers.
Okay, and then who is eligible? They're still looking for people to join this study, so they don't have the full 300,000 yet.
The push is on now, and specifically over the next month or two, the push is on to get people enrolled. It's open to anyone in the U.S. who's between the age of 30 and 65, who's never had cancer, except maybe a squamous cell or basal cell of the skin, but people who've never had cancer and are willing to commit to a long-term study. That means they're willing to commit to follow-up surveys for the next 20 to 30 years.
So if someone wants to join this, what information then are they collecting from this study?
So there's some enrollment events coming up, but if someone attends an enrollment event, they'll get consent forms, which says that they agree the cancer society is going to collect your data. They'll do a little survey about their health. They'll take body measurements, probably a body mass index, those sort of things, and they'll get a blood sample. Then the people will get a survey sent to their home, a fairly long survey, very thorough survey they'll mail to your home that they'll fill out at home and send in.
Okay, and then enrollment events, you had mentioned something about that. Is there places that people can go to enroll in something like this?
Right, so remember they're going to get the survey at home. Let me finish on that though. And then for years and years, they'll be getting surveys periodically. And they'll be followed.
Will people come to their house, or they get booklets, or how does it work?
They'll get sent in the mail.
Oh, okay.
Or I assume email now.
Yeah, like Nielsen ratings, kind of one of those things. Send you a book, here, fill it out.
So there's enrollment events happening all around Jacksonville in November. Mainly at a lot of the Baptist medical centers and also at Florida Blue, and I really encourage everyone to participate. It's a great way to give back to your community. It'll help us identify risk factors for cancer, and I think there's a real good potential to save lives.
Yeah, well, look at what the first study did. I mean, that was incredible. I mean, that was so disputed back then, and now we've come so far, and it's just common knowledge. So, all right, thank you, Dr. Ackerman, as always, for being here. For more information for this, if you would like to look about those screenings or those enrollments, you can do that. You can connect with Dr. Ackerman on Facebook by visiting his Facebook, which is facebook.com/First Coast Oncology.